Acid-base imbalance. We all know that the normal physiological range of blood pH is 7.35 to 7.45. If the blood pH decrease below 7.35, this condition is called acidosis. But if the blood pH increase above 7.45, this is called alkalosis. And always remember this mnemonic, which is the relation between carbon dioxide and subsequently carbonic acid, which comes from fusion of carbon dioxide with water. Therefore, the relation between pressure of carbon dioxide and carbonic acid subsequently to the pH. The relation is the reverse in respiratory types, respiratory acidosis and respiratory alkalosis. But the relation between the two, pressure of carbon dioxide and pH, is the same in metabolic types. Reverse begins by Re and the respiratory begins by Re, and the same end by Me, and the metabolic begins by Me. This is the mnemonics of the relation between pressure of carbon dioxide to the pH. In this video, we will discuss the respiratory types, respiratory acidosis and respiratory alkalosis. And always remember, in acid-base imbalance, this important ratio, which is the ratio between pressure of carbon dioxide to bicarbonates. What is the meaning of respiratory acidosis or alkalosis? From its name, respiratory means the cause is defect in the respiratory system, which is sure reflected on carbon dioxide pressure in the blood. Therefore, in respiratory acidosis, the primary problem is respiratory insufficiency, leading to accumulation of carbon dioxide in the blood with increase of pressure of carbon dioxide. And here, increase of carbon dioxide, the reverse in respiratory types. Increase carbon dioxide leading to decrease of blood pH. What is the cause of this condition? The cause of this condition, which is accumulation of carbon dioxide in the blood, is depression of respiration, which is due to respiratory insufficiency. Why respiratory insufficiency occur normally and physiologically? There is a respiratory center in the medulla, gives impulses through central nervous system and peripheral nervous system to respiratory muscles. And if the lung and the respiratory muscles are normal, the respiratory movement occur, expansion of the lung occur, proper respiration occur. But if there is depression in the respiratory center, if there is paralysis of respiratory muscle, or there is depression of respiratory movement, or the defect may be in the lung, in lung disease. What is the cause of depression of respiratory center? As CVA, cerebral vascular accident, which is cerebral thrombosis, cerebral embolism, head trauma, or the effect on the respiratory center may be due to compression by brain tumor, or depression of respiratory center may be due to drug toxicity like narcotics. Paralysis of respiratory muscles may occur due to spinal cord injury above the level of C4, which is the origin of phrenic nerve. Also, respiratory muscle may occur in the rare disease which is called myasthenia gravis. Depression of respiratory movement occur if movement of respiration is painful, like chest trauma with fracture ribs, or after chest surgery. Finally, the problem may be in the lung like chronic obstructive pulmonary disease, or collapse of the lung due to any cause, like pleural effusion. Therefore, depression of respiratory movement leading to respiratory acidosis with accumulation of carbon dioxide in the blood and decrease pH, which means increase acidity. What is the compensatory mechanism for respiratory acidosis? We all know from acid-base balance in the previous videos that the first line of defense against any changes in the blood pH is chemical buffer. Chemical buffer is the first defense mechanism, followed by renal compensation. In respiratory acidosis, the kidney is sensitive for changes in carbon dioxide. And any increase in carbon dioxide level in the blood is compensated by the kidney to reabsorb bicarbonate. And sure, we all know that if there is increase in carbon dioxide and in the same time the kidney produce similar increase in bicarbonate. Therefore, the ratio between carbon dioxide and bicarbonate will be corrected, leading to maintenance of normal pH. And we should notice that in renal and lung compensation, the idea of buffering by the kidney and the lung is to produce similar heat changes. Similar heat changes in the pressure of carbon dioxide and in bicarbonate to maintain the ratio between pressure of carbon dioxide and the bicarbonate. And what is the clinical picture? Clinical picture of respiratory acidosis. The patient becomes fatigued with muscle weakness, passing to drowsy, passing to coma. Why? We should notice that acidosis inhibit synaptic transmission in the CNS. Acidosis inhibit synaptic transmission in the CNS. And this is logic. Logic why? There is acidosis. If the patient is alert and moves irritable, this will produce more acids. Therefore, acidosis inhibits synaptic transmission in CNS, which is protective mechanism to avoid muscle activity and to avoid irritability, which produce more acid. And headache, nausea, vomiting. Why? Headache, nausea, vomiting is due to vasodilatation, hyperacidity of the blood, and increased acidity of the blood produce vasodilatation all over the body. Vasodilatation of cerebral blood vessels, leading to some sort of increase intracranial pressure with headache, nausea, vomiting. Due to vasodilatation all over the body, what are the suspected changes in the blood pH? In the blood pressure. Sure, generalized vasodilatation leading to hypotension. Finally, usually the respiration is depressed. Why the respiration is depressed? Due to the cause. There is depression of respiration, which is the cause of all these conditions. Therefore, the patient have dyspnea with shallow, rapid breathing. Shallow, rapid breathing. Sure, we should notice that this is not logic. Acidosis with increased carbon dioxide level, and there is depressed respiration. Usually, the compensatory mechanism is increase respiration to evacuate carbon dioxide from the body through expiration. But this is not logic, but it has the cause. The cause is already respiratory problem. leading to depression of respiration, and clinically there is dyspnea with shallow rapid breathing. What are the laboratory diagnosis? Sure, we should measure blood pH by pH meter and the pressure of carbon dioxide and oxygen, estimation of bicarbonate in the blood, and electrolyte measures. Because sure, from the previous videos, we know that blood pH affect the blood electrolytes. Sure, in acidosis, what is the blood pH? أكيد sure below 7.35, and there is increase of both carbon dioxide and increase of bicarbonate. Renal compensation, increase bicarbonate to produce the balance and maintain the ratio between carbon dioxide and bicarbonate. Acidosis. Acidosis has an important blood acidity or alkalinity. Blood pH affected two important electrolytes, potassium and calcium. Hyper acidity of the blood, acidosis, leading to hyperkalemia and decrease in the level of ionized calcium. Why? We should notice that in acidosis, the hydrogen ion enter the cells in exchange with potassium ion which get out from the cells. Therefore, if potassium get out from the cells into the blood, leading to hyperkalemia. And we should notice also that acidosis increase the ionized calcium in the blood. What is the treatment of respiratory acidosis? The treatment of respiratory acidosis is improve ventilation. How? There is depression of respiratory center and paralysis of respiratory muscle or lung disease. Improvement of ventilation even by mechanical ventilator and oxygen therapy. This is the respiratory acidosis. We will continue in the next video. Thank you for good listening and good luck.